Hello, my name is Emmanuel.
And my name's Nathan. Today, we're thrilled to present Challenges Deploying Robots During a Pandemic, an effort to fight social isolation among children. This is a joint work between the Interactive Machines Group and the Social Robotics Lab at Yale University. The practice of social distancing due to the COVID-19 pandemic opposes our natural drive to connect with others. Billions of people quarantined in their homes this year as workplaces and schools required lockdowns to prevent the virus from spreading. These social distancing mandates were instituted to promote health and safety, but unfortunately exacerbated the effects of loneliness, which was already an important societal challenge. While teenagers and adults may be better at coping with the sudden transition to electronic or virtual means of interaction, elementary, school-age children, especially those between the ages of 5 and 12, are more likely to experience the harmful effects of social isolation. These children often haven't yet developed the skills or patience necessary to engage with others through electronic or virtual methods. During childhood, the development of social skills through physical play is crucial to long-term achievement and social functioning.
Although robots are currently used to combat the effects of the COVID-19 pandemic in tasks such as disinfecting and areas such as logistics, clinical care, and surveillance, their potential to mitigate implications of social distancing remains understudied.
To advance our understanding of this potential, and in an attempt to mitigate the social consequences of the current pandemic, we explored one way in which robots can help children with social isolation. In particular, we developed a robot teleoperation system called VectorConnect, an application for elementary school-age children to engage in physical play while being geographically separated. After initial application setup, each user is then able to control a local vector robot. A video call between two devices can be started, and control of the local vector robot handed off to the remote user.
Having identified the problem of social isolation among elementary school children during the early days of the pandemic, we set out to find a way to help these children and their families to connect with peers in a meaningful way. Our project was not intended as a traditional HRI study, but rather an outreach effort. Our design goals were first, to enable physical play between children as if they were co-located. Second, the system must be secure and respect users' privacy. And third, the system needed to be simple for parents to help set up. Finally, the system needed to be engaging for children. Based on our design goals, we decided to develop VectorConnect, a mobile application that allows children to play remotely with their friends and distant family using an inexpensive commercial robot. Using our software, we enabled a child in one home to use a phone or a tablet to take control and become the robot in another child's home. This facilitates the play of physical games such as hide and seek, or building and navigating challenging obstacle courses via robotic telepresence. In addition, our mobile application provides the means for the children to speak and interact with each other over video calls on the device, creating an environment conducive to social interaction during this physical play. In this interaction, the child on the left is navigating an obstacle course using the remote robot on the right side of the screen. Having seen how the app works, let's talk briefly about the implementation details. The connection between mobile devices for video calls and transfer of robotic control commands occurs over a web real-time communication or WebRTC connection, after negotiation using a traversal using relays around NAT or TURN server. In line with our security design constraint, the WebRTC connection is strictly peer-to-peer, ensuring no sensitive data flows across our servers. Furthermore, call IDs serve as a private key between parties and must be exchanged via a channel outside the application, such as a phone call or text message between two households before establishing a connection in the app. As part of Anki's open source API for Vector, Google Remote Procedure Call, or gRPC, files are provided. We use these interface definitions along with the gRPC implementation in the Dart programming language, compatible with our front-end framework, to control the vector robot. Due to security constraints on the vector robot itself, establishing this connection was challenging. For others who may be interested in performing similar control of a vector robot, the details of this connection are described in the paper. The system's front end was implemented using the Dart programming language and the Flutter mobile app development framework. This choice enabled us to use a single code base and compile to both Android and Apple mobile devices with identical user interfaces. We designed this user interface to be as easy to use as possible.
Our application was made available for free through both the Apple App Store and the Google Play Store. At launch, we promoted our application in several articles and social media posts. With the generosity of a donor, we gave away robots to the first 200 families in our community who requested one through our website. These robots were given away unconditionally without requiring users to test our app or complete its surveys.
Prior to general public release, we performed pilot testing with children who helped us verify the usability of the application and envision new play scenarios. Finally, we created a project website and support email account to aid in user adoption and retention, with the goal of increasing the impact of the system.
We included several surveys in the application. The first was a short, one-question visual survey designed for children following the Smiley-O-Meter by Reed et al. An example of this survey is shown here on the left, with 113 responses shown on the right, collected between June and September of 2020. In the application, this survey appeared with 10% probability each time a video call ended. There were also longer form surveys, designed to collect demographics data, which we discuss next.
Detailed demographic data from the long-form demographic survey is presented here. I want to highlight that most children were in the target demographic of 5 to 12 years old, with a median age of 9. These children were mostly staying at home and not attending school due to the pandemic. Many were lonely and wanted to interact with faraway peers, and the majority interacted only weekly or less frequently with other children remotely while home due to the pandemic.
In terms of system adoption, we had far more users than the number of robots we were able to distribute to the community, though we were surprised to find that many users only used the application to control the robot and did not use the video calling feature. These numbers lead us to believe that the impact of our system extended beyond that of our local community, but part of the impact came from users that found our application useful in unintended ways. Diving a bit deeper into usage data for the video calling feature, we find that while many users made video calls without using a robot or teleoperated vector, the total duration of events with both robot control and video calling was greater on average for users of both features. That is, users that controlled the robot and used the calling feature stayed engaged for almost twice the amount of time of those that controlled the robot but did not use the calling feature. We considered standard user engagement metrics to evaluate the relevance of our system in users' lives. In particular, we looked at daily active user, DAU, weekly active user, WAU, and monthly active user, MAU. We computed the ratio between these metrics as a measure of user retention. Though we do not have a good reference in the mobile application space, our metrics are in line with a recent study on Facebook apps, which reported a DAU to MAU ratio in the 5 to 9% range for games, lifestyle, and entertainment apps. Next, we'll briefly discuss some of the barriers and challenges we faced, including disruptions of normal institutional operations, as well as some opportunities and recommendations.
The main challenge we faced was the disruption of normal institutional operations. For example, routine activities that could have been resolved in one in-person meeting instead required many more virtual ones. It was not only our institution that was disrupted, but also local elementary school operations were disrupted. This made distribution through local schools impossible. Instead, we attempted to raise awareness via media contacts. However, news agencies and journalists were largely preoccupied covering the pandemic, leaving little bandwidth for our project. This challenge could have been eased if there were an organization in the robotics community that was ready to publicize and distribute our system. An example of the type of organization is the Center for Robot Assisted Search and Rescue, or CRASAR. CRASAR is a proponent for the use of unmanned systems for emergency response and public safety. An organization like CRASAR in the social robotics community could make it easier for teams like ours to take action faster in the future. A proactive stance and coordinated community effort could better enable social roboticists to quickly address the social impacts of future infectious disease outbreaks. Our outreach efforts to address the negative effects of social distancing on elementary school-aged children can help raise awareness of the potential roles that social robots can play. We hope some of our experiences are helpful for those facilitating similar future efforts in the HRI community. For more information, please see the paper and the project website.